Week-by-week pregnancy symptoms. Although the symptoms of pregnancy vary from one woman to another, a delayed or missed period is the most important symptom experienced by all pregnant women. Pregnancy is an important phase of every woman's life. The mother and the baby both undergo a number of changes during this phase. It is the mother's responsibility to take care of her as well as her baby's health. The duration of a full-term pregnancy is of 280 days or 40 weeks. These 40 weeks are divided into trimesters of 13 weeks each. If you are planning to have a healthy baby and a trouble-free delivery, it is necessary to know the pregnancy symptoms by week. This information may help you avoid a miscarriage or any other complications during pregnancy. The first trimester. Week 1, the first day of the last menstrual period, is considered as the first day of pregnancy. Actually, your pregnancy has begun about 2 weeks before the conception, when an egg leaves the ovary and travels through the fallopian tube for fertilization. Progesterone and estrogen is produced by the body to promote ovulation and fertilization. You should start taking 0.4 milligrams of folic acid daily, and make healthy lifestyle changes such as stop alcohol consumption and smoking, intake diet rich in vitamins and other nutrients, etc. Week 2, your body ovulates, and when the sperm and the female egg unites, fertilization takes place. You should plan in advance about your health checkup, and also choose your health care provider. Week 3, during this week, the baby will grow quite fast. Rapid division and growth of fertilized cells takes place, and the cells then enter the uterus in the form of a blastocyst. When the blastocyst attaches itself to the uterus wall, it is referred to as implantation. Development of the amniotic sac and cavity begins as estrogen triggers the reproductive organs to begin preparing for motherhood. Some early pregnancy signs like bloating, cramps, breast tenderness, and mood swings may be noticed. Week 4, now, the blastocyst is implanted deeper within the endometrium. A pregnancy hormone called human chorionic gonadotropin, HCG, is produced. The ovary will stop releasing an egg every month. The baby at this time measures around 0.04 inches. Progesterone has a sedative effect, plus the pregnancy hormones racing through your body can make you tired and sleepy. This early stage of pregnancy may result in cramping and some spotting, but many women feel no change in their bodies. Week 5, you may experience morning sickness. During the 5th week, the embryo starts achieving a definite shape. The placenta, through which the baby gets nourishment, also develops, and the baby's facial features, the neural tube, bones, and muscles begin to form. Week 6, now that your pregnancy is officially confirmed, your blood will be screened for its Rh factor and Rh incompatibility. It's time for a complete physical examination and noting down your weight. The baby's heart will start beating, which can be noticed in an ultrasound examination. The brain, nervous, respiratory, and digestive systems of the baby start developing. The baby measures around 0.08 inches in this week. Week 7, the umbilical cord, and the leg and arm buds begin to develop this week. The cerebral hemispheres of the brain, pancreas, and appendix develop, and an intestinal bulge is also noticed. The symptoms like breast tenderness, bloating, abdominal pain, frequent urination, nausea, and weakness might be noticed. The intake of folic acid can help reduce the chances of birth defects. Week 8, the baby's eyelids, optical nerves, and the retina will be formed. Fast development of the ears, nose, and throat can also be observed. The baby's genitals appear like small buds. You may experience food cravings because of some sort of nutritional need of the body or nutritional balance required by the body. Week 9, the arms and hands of the baby grow and become longer. The legs continue growing. Owing to the developed muscles, you can feel some movement. The ears and eyes can be seen during ultrasound examination. The baby measures around 0.90 inches and weighs around 2 grams. Week 10, after the 10th week, the embryonic stage ends and the fetal stage begins. The baby has all the vital organs by now. Formation of tooth buds can be noticed, and if it's a baby boy, the testes starts producing testosterone. The uterus is of a soft ball size. Food cravings, mood swings, and constipation are some of the noticeable symptoms for this period. Week 11, your waistline may start growing. The number of blood vessels in the placenta increases to support the rapid growth of the fetus. The glands such as the pancreas, gallbladder, and thyroid start developing along with the baby's reflexes. Fatigue and stress are the main symptoms observed by the mom. You should start practicing Kegel exercises which strengthen the pelvic floor and tone the vaginal and perineal area, so that the later stages of pregnancy will be trouble-free. Week 12, the fingernails and vocal cords are developed, and the kidneys of the baby start working. The pituitary gland of the baby starts functioning. Week 13, here ends the first trimester. Now, the face of the baby will appear more human-like. The fully developed placenta provides the necessary nutrients and also helps in waste disposal. The intestines move from the umbilical cord towards the stomach. The second trimester. Week 14, your morning sickness may subside now. The baby's thyroid gland will start producing thyroxine. Now, the baby may start swallowing, breathing, sucking, etc. Week 15, you should include calcium and protein-rich food in your diet as the skin and hair of the baby start developing, and the bones grow harder because of calcium retention. The baby may measure around 3.98 inches and may weigh around 70 grams. Your waistline must have grown by now, and your belly will also begin to show soon. Due to the lack of space in your stomach, you are likely to experience more heartburn, indigestion, and flatulence. Frequent urination may also be experienced as the bladder has less room to expand. Week 16, you may experience Braxton Hicks contractions which are painless and random. The baby's movements can be felt and various facial expressions can also be observed during examination. Now the baby has stronger head and neck muscles, which enable him to hold his head erect. Week 17, get tests done for gestational diabetes. Your lower abdomen starts popping gradually, and the breasts start preparing for milk production. There is a noticeable increase in the baby's weight. Now, the baby's kicks become more prominent. Week 18, there might be difficulty in sleeping, as your baby bump grows. Now, the bones of the baby will start ossifying, the ears will continue developing, and the meconium, fecal waste matter, will start collecting in the baby's bowels. You may notice a dark line extending from your belly button to your vaginal area, which will disappear after birth. Week 19, vernix caseosa, a white creamy fluid, will now cover the baby's body to protect the glands and sensory nerves. In case of a baby girl, the egg cells will be formed in the ovaries. Week 20, along with the other symptoms, you may experience strong and frequent fetal movements. The baby's hands and nail grow remarkably, and the uterus expands to make room for the growing fetus. An ultrasound can help determine the gender of the fetus. Week 21, you will notice that several pregnancy symptoms disappear. As the digestive system of the baby starts functioning, the baby starts swallowing the amniotic fluid, which enhances the functioning of the digestive system. The baby now measures around 10.51 inches and weighs around 360 grams. Week 22, the baby's taste buds and nerve buds are fully developed by now, whereas the sense of touch and the reproductive system continue to develop. Backache, heartburn, and indigestion may be experienced in this week. Week 23, your weight must have increased by 11-15 pounds. The baby starts responding to sounds, and also starts producing insulin with the help of the pancreas. Week 24, the developed lungs now produce surfactant, a substance that prevents the air sacs from collapsing after the baby is born. Week 25, small blood vessels are developed, the color of the skin turns pink, and the baby is capable of hearing and recognizing some sounds. Swollen feet and ankles may be noticed by the mothers when they work for the whole day, without taking any break. Week 26, all the 5 senses are fully developed by now, and the baby may develop a certain sleeping pattern. Hair and eyelashes have grown quite well. During this last week of the second trimester, the baby is around 14 inches long and weighs around 760 grams. The third trimester. Week 27, the optic nerve of the baby develops along with the sense of sight, while other organs, immune system, forebrain, and lungs of the baby are still underdeveloped. Week 28, the baby's brain develops the grooves and folds. Fats get accumulated under the skin, which increases the body weight. The baby now appears healthier. Week 29, there is a remarkable increase in fetal activity, and the chances of survival in case of a premature baby are high. Week 30, you may feel tired, achy, and sleepless. Convulsions may develop in the brain. Nerve cell activity is rapid during this maternity stage. Week 31, around this time, the baby starts urinating several times, into the amniotic fluid. As the growth of baby's organs continues, you also gain weight gradually. Week 32, in the ultrasound examination, eyelids, eyelashes, hair, mouth, etc., of the baby are clearly visible. You might experience back pain and achy legs due to weakened stomach muscles. Week 33, the baby can detect light, and the constriction and dilation of the pupils can now take place. As there is continuous deposition of fat, rapid weight gain is observed. Week 34, the baby starts preparing for the arrival into this world by adapting the position for delivery. A thick coating of vernix caseosa can be observed. Week 35, normally, the baby's position will be head first. Week 36, the baby's head is in the mother's pelvis. The skull bones of the baby naturally tend to overlap each other, so as to facilitate trouble-free movement of the baby through the birth canal. The baby is quite healthy now,